Hope Channel, changing lives.
Hi, good evening and welcome to the program Wounds of the Heart, where we are here to help you heal any form of wound that has been caused by addiction, any social or mental issue. And we are here to bring people, experts, to sit down with them, to interview them, to help you out from that thing. So I'm very glad that you share and let your friends who are also far away from near also have the access to watch this program. And today I have a special person who had been watching my program from day one. And he has been very instrumental to my program. He always calls to greet and he always comments on my program. Today I have him on set, and very soon I will let him introduce himself. But I just want you to know that this program is made possible by Hope TV. And if you want to sponsor Wounds of the Heart, the number is 0559 535554. 0559 535554. Or if you want to ask any question, or if you want to also be a guest on my program, you can also call the same line, 0559 535554. And I'll talk to you. It's still on WhatsApp, so we can just discuss anything and we can arrange for you to come on my program. And I want to thank today Alsa Clothing at Musuku Police Station. He gave me this shirt to wear to be on set this morning. This evening, sorry. Alsa Clothing. You can locate Alsa Clothing at Musuku Police Station, and the contact is 0246 900 994. 0246 900 994. He deals in kaftan, office wear, casual wears. As you can see my casual wear this afternoon. Casual wear, female and male collection. So you can call Alsa Clothing on all social media handles. It's Alsa Clothing, and you can just call him. He's just a phone call away. I want to thank Alpha Art also to always putting me up there on the flyer. Alpha Art is 0551 404 8387. Alpha Art. You can book Alpha Art for any program. So far as his graphics, he's right there. And if you want to comment on this program, is 0459 680066, 0559 680066. We are live on Facebook and YouTube, Hope Channel Ghana. So when you go on Facebook and YouTube channels, we are still live there. Today I have a gentleman on my program whom I'm going to discuss issues with. I'll let him introduce himself for us to know who he is and the caliber of person today I am interviewing. Doc, good evening and welcome to the program.
Thank you very much, Pastor.
Doc, please, for the first time, I want my viewers to know who Doctor is. So, Doctor, please, can you tell us who you are, your name and your profession, please, so that my viewers will know who I'm talking to this evening?
Thank you very much. Dr. James Boakye Fojo, popularly called Dr. Fojo.
Dr. Fojo, okay.
Or JB Fojo.
Okay.
A gynecologist at the SDA Hospital in Sunyani.
Okay.
Formerly, I was working with the regional hospital.
Okay.
And after retirement 12 years ago, I worked with the hospital for another 10 years. But currently, I'm working with SDA Hospital.
All right. So currently, Doctor is working with the SDA Hospital. He's Doctor, for how many years have you worked as a gynae?
35 years.
And counting.
35.
All right. So viewers, today I have a renowned person, somebody who is experienced in the discussion we're going to have today. We're going to discuss issues related to prenatal or pregnancy before delivery. So we are here to talk about pregnancy, its psychological effect, its issues, and how best we can help our wives, our mothers, our sisters who are pregnant and what they go through during pregnancy. Doctor, before everything, what is pregnancy? It may sound well, but what is pregnancy?
Yeah, thank you very much, Pastor. Pregnancy is when a male sperm meets the woman's egg or what you call the ovum.
Mm-hmm.
The moment they meet, fertilization takes place, and we can say that pregnancy has actually started. So it's the fusion of the sperm and the egg.
The fusion of sperm. And when do we know that that lady is pregnant or that woman is pregnant? Is it just fusion now,
Right.
then?
No, the moment the fusion takes place,
Mm-hmm.
certain things happen.
Okay.
It takes place in the fallopian tube.
Mm-hmm.
You have the uterus, or what we call the womb.
Mm-hmm.
We have two tubes attached, one on the left, one on the right.
Mm-hmm.
The ovary is attached to the end of the fallopian tube.
Mm-hmm.
And when the egg is released, the sperm will travel from the cervix to the womb, the endometrium, and will go and meet the egg in the fallopian tube.
Okay.
That is when pregnancy takes place.
Okay. So when
And after a few days,
okay.
it will come and land in the uterus.
Okay.
And there are a lot of signs that will show.
Okay.
So the first thing that will show in the woman is that
wait,
she
we'll get there.
misses
We'll
her
get
menses.
there. Ada, wait. We'll get there. So, is it any time that when a man and a woman have sex that they will get pregnant? Is it any time, or there's a specific time?
No,
that,
please.
Yeah.
No, please, Pastor. No, please.
So when
That's why I said
Uh-huh.
the egg and the sperm. So it means it's only at ovulation.
Oh, beautiful. Okay, that is what I want my
Where
viewers to know. Mhm.
ovulation means a mature egg
Mhm.
has been released.
Okay.
So
Okay.
it
Okay.
happens once in a month. And
Once
that's
in
the
a
only
month.
time that when you meet, pregnancy can take place.
Whoa.
Unfortunately, for most people, they meet outside ovulation.
Okay.
I have a lot of cases here where they come for infertility. And I ask whether they are staying together. No, my husband is in Accra, I'm in Sunyani.
Oh, okay.
So I ask, how often do you meet then?
Uh-huh.
Oh, on weekends. And then I ask myself, God hasn't stated that ovulation should take place on weekends.
Oh,
It can
weekends,
take place
okay.
anytime.
Okay. Okay.
So
okay.
supposing your husband travels all the way from Accra to Sunyani after 8 hours of journey,
Mm-hmm.
comes home tired, tries to meet you in the evening. The following Saturday you meet, Sunday he's off.
Uh-huh.
And the egg is released on the following Wednesday. There's no way you can ever get pregnant.
Mm.
Because the egg stays for only about 24 hours.
Mm. Mm.
After 24 hours, the egg is not working anymore.
Mm. Mm.
So if you are going to meet like on a Wednesday, you are in trouble.
Mm.
It can't. Pregnancy can never take place.
Okay.
So pregnancy takes place only during ovulation.
Mm.
Only during ovulation.
Mm.
When the egg has been released
Okay.
and the sperm goes to meet it. Otherwise,
Okay.
no, there's no way pregnancy can take
Okay.
place.
So, Elder, it's Doc. It's advisable that when a couple want to get pregnant and they are staying in different places, the husband or the wife should meet they should meet before ovulation and relax after ovulation before, if one need to travel, he travels or she travels. Is that what we are saying?
Partly so,
Okay.
but not
Okay.
completely so.
Okay.
What I'm trying to refer to is that you should meet when the egg has been released.
Mhm.
So whether you travel from Accra to Sunyani, you are tired and you are able to meet your wife
Mm-hmm.
and you release the sperm,
Mm-hmm.
irrespective of whether you are tired or not, and the sperm gets there, pregnancy will take place.
Okay. Oh, okay. Okay.
Yes, yes.
Okay. So I hear this myth that when men sit for a while, like from Sunyani to Accra, would be about 9 to 11 hours, 9 to 10 hours. Let me put it that way. And the husband will sit in the bar, serve these hours, get to Accra Friday night, and expect something to do with the wife. The myth I don't know whether you disprove it or approve it, that the sperms will be weak, that it can't swim into the ovaries. How true is it? Is it true or is it just a myth?
It's a myth, Pastor.
Okay.
It's never true.
Okay. Okay.
Once you are able to release the semen
Mm-hmm.
into the vagina
Mm-hmm.
around the cervix,
Mm-hmm.
and the sperms are able to travel through the endometrium,
Mm-hmm.
you have no problem.
Okay.
The sperms don't get tired. They don't. They don't get tired like the men get tired.
Okay.
Once you're able, the only problem, Pastor, probably will be the man is too tired to erect and to eject the semen. Apart from that, once you're able to do it, pregnancy can take place.
All right.
Once it's obliged. Yes.
So viewers,
it's not true that the sperm will get tired and therefore they can't swim. No.
Okay. So viewers, in case you just joined us, we are discussing issues concerning pregnancy, psychologically, and how best we will be able to help our wives, our mothers, our sisters, and our aunties go through pregnancy successfully without those issues occurring. We are just talking about how pregnancy is formed. You can still go on our Facebook and our YouTube page. If you miss it, you can go back and watch them. Doc, so pregnancy is beautiful. Should couples be ready to get pregnant before they should get pregnant, or as soon as they get married, they have the right to get pregnant?
Yeah, thank you very much, Pastor. As soon as they get married, they have the right to get pregnant. But there's a caveat.
Okay. Tell us.
They are married all right. But the woman is in school, not ready to get pregnant at the time. So in that case, they can wait. But otherwise, once they are married, they have the right to get pregnant.
Okay.
All things being equal. In other words, the man is adequately prepared. The woman is also prepared.
Okay.
In that case, nothing bars them from getting pregnant.
Okay. The couple shouldn't say we want to chill a year or two before we'll try to make babies. Once they have married and somebody is not in school, they should prepare because they don't know when. And do we also have an age limit for making babies?
Yeah, thank you very much, Pastor. That's a very important point that you just raised. We want to chill for a while before we get pregnant. We want to enjoy ourselves, travel up. No. Time is not on our hands.
Okay.
Especially for the woman. I would say in quotes, the woman has an expiry date.
Expiry date, in quotes, okay.
In quotes.
Yeah.
Unlike the man who, even at 70, can still impregnate somebody. The woman after 40, fertility falls drastically. So if you haven't had a child around 40, your chances of getting pregnant slims a lot.
Oh, okay.
Very, 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 very slim.
Okay.
Even though a lot of them can get pregnant.
But
it is not as convenient as when you are in your 20s, late 20s, early 30s.
Okay.
Yes.
Okay.
Ideally, we prefer that by 35, you should have completed with your family.
Ideally.
I'm saying ideally because these days, most of the girls, by the time they get pregnant, they are around 30.
Yeah.
Because they have to get their vocation.
Okay.
Some of them want to get their first degree. Some even want to go further for their second degree before they get married, and that is not good for them.
Okay.
Because ideally, but the best time to get pregnant is around 20, 24, thereabouts.
Doctor, you are throwing pressure on people.
No. I'll just explain. I'll explain things.
All right.
In the olden days, when women didn't used to go to school a lot, for example, I can cite my mother. Those days, once you are 18, they show you to the queen mother, they check your breast, you are not pregnant, they hand you over for marriage.
Okay.
So most of them around 18, 19, they have had their first child.
Whoa.
And usually, within the next 2 years, the second one will come.
Okay.
It was like a natural family plan.
Natural, okay.
No wonder in those days, Pastor, you come to our area here, some people are able to get 10 children.
Exactly.
11, 12 children.
Exactly, because they started early. Okay.
Because they start around 18, 19, 20.
And
every 2 years, they get a child. Every 2 years, they get... So, with the twins sometimes coming in. So, I met one woman in Doma some time ago who had 16 children. 16.
Whoa, 16.
But she had three sets of twins.
Okay.
So that alone makes 6. And then everything was going on. But these days, as I said, Pastor, they have to finish school, they have to get job, they have to make sure they are secure. And by the time they finish their first degree or something, now around 27, 28. Most of them get married nowadays around 27, 28. and they have to battle with infertility for a while.
Oh, okay.
Doing checks here and there. And by the time they get their first child, most of them are 30, 32, 33, thereabout. But here I have a lot of them who are getting their first child at 37.
Whoa.
So at 37, you wait for another 2 years to get another one. You are 39 already. You are getting 40. And that is the age which is not too good for getting
pregnant
a baby.
Okay.
Because a lot of factors that we're going to discuss will also come in.
All right. Thank you, Doc, for saying a lot of factors. So now, my people, our wives, our mothers, our sisters. So if you have the chance and you are fit to marry, please do so. Don't wait till do so, because we don't know what may happen. And as Doctor is saying, it wouldn't be prudent for us to get into our 35, 36 before we will try to. And sometimes when it happens, also for us, you go to Pastor, pray for me. I want to do this, and you'll be walking here and there just to let us give ourselves a beautiful time, and let's work towards that. Doc. Now we are entering into.
But Pastor, before you continue,
okay, Doc.
That doesn't mean we should rush to getting pregnant. No.
Exactly.
Make sure you are secure.
Make sure
you have a work to do that will generate, because you can never tell what happens after the marriage. So we are not saying everybody should rush. You know, Pastor, this JHS exam that just ended, BEC, a lot of the girls were pregnant and had delivered. A lot of them.
Oh.
If you get the figures, you'll be amazed.
Whoa.
I know a place where some of the girls had to bring their babies, breastfeed them after one paper.
Oh.
And a lot of them were still pregnant. Writing the papers. And that is not too good for you.
It's not too good. It's not too good.
But that is the ideal time. If you get pregnant, everything moves smoothly for you. But don't rush into it.
All right. Thanks, Doc, for that very beautiful clarification. So, Doc, what? So it's beautiful when. So don't do. This couple get after marriage, after honeymoon. People try to do their shot after honeymoon, and a lot of children are out as a result of honeymoon. Now pregnancy have started. The lady have tested and she's pregnant. What are the physical symptoms that, aside, would trouble the woman? What are that impact pregnancy? What are some of the physical symptoms that impact pregnancy negatively? Although it's beautiful for the woman to have pregnant, but negatively, the symptoms that impact pregnancy. I want us to discuss that and see how best we'll be able to help out. Doc, so tell us more about that.
Okay, thank you very much, Pastor.
You're welcome, Pastor. Doc.
The moment pregnancy starts, a lot of the women, majority of them will start with what we call nausea.
Nausea, okay.
Nausea, they are not able to eat well, they feel like vomiting, they feel very weak. And the severe form is called hyperemesis gravidarum. Hyperemesis gravidarum. That is hyperemesis. Hyper means it's on the high side.
High, okay.
Emesis means vomiting.
Vomiting.
And gravidarum means associated with pregnancy.
Pregnancy, okay. So high vomiting associated with pregnancy.
Yes, high vomit. A lot of them.
Okay.
They vomit like nobody's business.
Okay.
They are not able to take in any food. And even the soap that they used to use, the smell, they can't cope with it again.
The smell.
The husband comes near and says, no, please go away. I don't like your smell. It's not easy, Pastor. And some of them is so severe that they have to be admitted for infusion.
Whoa.
Some of them, they have to be admitted for infusion. Because they become so dehydrated that it's even getting bad for them. And if you don't work on them, it can even cause their death. So the vomiting is a very, 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 very bad one that a lot of them experience. And in my case, my wife had it a lot, yes. Whoa. And I really suffered, yeah.
Okay.
They also tend to get urine frequency. They urinate, and the next 5 minutes, 10 minutes, they want to urinate again. Why? Because a lot of changes, hormonal changes are taking place.
Okay.
And the uterus, which is closely attached to the urinary bladder, is also irritating it.
Okay.
So frequency of urination.
Okay.
Yes.
Okay. So
it's very common, most of them.
Urinating and some smell.
Yes, okay. Please, Pastor. A lot of them tend to get what we call pregnancy-induced hypertension.
Pregnancy-induced hypertension. Okay.
Normally, by the very first week to the second trimester, their BP will fall down a bit, which is very good for them.
It's very good.
But as they get to the second trimester, which I will explain later,
okay,
a lot of them will start getting the BP going up. And that's something we very much don't want to see. Especially if the blood pressure is going up and you test your urine and it shows protein. Protein in the urine, which should not happen.
Okay.
If you see the blood pressure going up and urine has proteins, we are heading into what we call preeclampsia, a very bad condition.
Whoa. And what is that?
Very, very severe condition.
What is that? What is that what is the meaning of that? What is it?
That's what I just tried to explain by saying in the second half of pregnancy, your blood pressure goes up. You test your urine and there is protein, which should not be there. Normally, there should be no protein in your urine.
Okay.
But this time around, you check your urine, there is protein. Either it's 1+, 2+, or 3+. And the BP is upasa. You are developing a very serious condition which can lead to the baby, number one, dying inside the womb, in utero. Or the mother progressing in what we call eclampsia. That means the woman has now gone into a fit. It's convulsing.
Okay.
It's a very dreadful condition, Pastor, that we don't want to see.
Whoa.
Because now it is the number one kind of killer for pregnant women.
Whoa.
All along the whole world, it is bleeding after pregnancy, after delivery, sorry.
Okay.
Which called postpartum hemorrhage. Maybe we'll get there another time.
Okay.
That's the number one killer for women in pregnancy or after delivery. But here is a case where now, because of the blood pressure going so high with protein in the urine, they progress to get a fit. And once that fit sets in, it means your brain has been damaged.
Hey.
Your liver is in trouble. Your kidney is in trouble. Once I look at the target organs that have been affected, your brain, your liver, your kidneys. And it goes to a stage where even the blood that is flowing through you, the blood, gets into trouble. And you develop what we call a DIC. Where DIC means disseminated intravascular coagulation. Disseminated intravascular coagulation. Which means all the blood in you is now coagulation. So the moment you deliver and you start pouring, you have no clotting factors to help the blood to stop. It's a very, very dangerous condition, Pastor. You start bleeding and it's non-stop. Even the site where they put a needle to put a drip is bleeding.
It's bleeding.
Supposing you had a cesarean section, the site is bleeding. And all the blood that is new cannot clot. Means you are going to bleed to death. And so, to make it more fearful, a term has been coined for this DIC, which is a very long medical term, disseminated intravascular coagulation. So when you get that one, we call it death is coming. DIC.
So you have changed the real meaning. You have changed the real meaning to death is coming, because no matter what happens, when a lady gets there in pregnancy, the possibility of the person dying is high.
Very high. 9 out of 10 people will die. Unless you have the place set up where you have fresh frozen plasma, platelets, or fresh blood. If you don't have them, the person is going to bleed to death. So it's not a legal term, but we have coined it to make it appear very frightful so that you don't get there at all. DIC. So, Pastor, the blood pressure going up is something we don't want to get tall. We don't want it. Especially if you get protein in the urine as well. A lot of the women will also develop sugar in the urine. In other words, they are developing diabetes.
Diabetes during pregnancy.
Because of pregnancy, because the hormonal changes and all that is going on. So they get what we call gestational diabetes. And diabetes already is a dreadful condition.
Exactly.
And now you are getting it in pregnancy.
Whoa.
Big trouble for us.
Whoa.
Big trouble. The developing fetus can get abnormalities. If they don't get it, they become so huge. We call macrosomic baby. Baby is very big. So when it's time to deliver, that's a big problem for us. 5 kilogram baby, Pastor, delivering through down there. Can you imagine?
Yeah.
The midwife will struggle, the head is out, the shoulders are locked in there. You call the doctor, you try maneuvers, and it's not coming. Now you have to resort to cesarean section quickly. Meanwhile, the head is out. The head is out. So do you have to push it back? It's a big problem. So diabetes already is a big problem. And in pregnancy, it's a big problem again. So they also tend to get that. Most of them will develop anemia. In other words, the blood will reduce.
Okay.
The hemoglobin.
Yeah.
Because the growing fetus, which is a parasite, in quotes, it's a parasite. It's not producing anything, but it's eating. So the blood that you have to be taken its share. And if it will take all that it needs, and you should even go into anemic condition and die, doesn't care. Forgetting that if you die, she also die, or the baby will also die. But no, to take the blood it needs.
Whoa.
Very, very serious. So most pregnant women will also become anemic. And that is why at antenatal, they give them pimatinix, medicines that will help to boost their blood. Most of them will also get what we call hemorrhoids, what the lay people most of the time call piles. So the anal area, there will be a swelling there. The veins will be swollen. Because of the pressure in the abdomen, they get piles. Others will also get hernia. And Pastor, when I say hernia, you can say, hey, is it true that women also get hernia? Yes, women do.
I'm shocked, Doc.
Yes, women also get hernia. We have done a lot of them for them. We continue to do hernia for women. Because of the pressure in the abdomen, it will push the intestines to wherever they have to go. And if there's the slightest space, your intestine will push through that space. And that's what we call the hernia. So women also get hernia. In the groins, around the umbilicus, and elsewhere, you can get hernia. The other thing we need to talk about is the weight gain. Because the fetus is growing, the placenta is also there. The liquor, in other words, the fluid in which the baby baths and swims and moves around, is also increasing.
Okay.
The weight will also increase. And Pastor, I want us to look at something here.
Tell us.
When you have to hold something like even 1 kilo, 1 kilo for just a short time, you find that you are getting tired.
Yes, Doc.
Yes. Unless you put it somewhere and take a rest, get tired. Here is a case where the baby starts putting on weight. By the time we deliver, most of them are around 3 kilos, 3.5. Some even go to 4 kilos. And imagine Pastor carrying a 4 kilo weight for not just 1 day, not 1 week.
7
but
months,
let's say
8 months. Yeah.
for 3 months,
3
7 months, or thereabout. It's not an easy thing, Pastor.
No.
They feel uncomfortable when they lie down to sleep. When they walk around, it's not easy for them. Your husband cannot say, oh, again, let me help you. Let me carry this thing for you. No, it's not possible. Your mom cannot help you in that wise. You'll be carrying it all through. It's not an easy thing, Pastor. So this weight gain is also there. There's another thing I want us to discuss before maybe we end this. A whole lot of issues.
No problem. Ed, I'm here with you.
But unfortunately, Pastor, you are wedded, you are praying for a pregnancy, fruit of the womb, and God gives it to you. You are very happy. But as I said earlier on, the fertilization has taken place in the fallopian tube. It's supposed to move into the womb proper. That is the place that has been prepared for the fetus to go and rest for the 9 months before it comes out. Unfortunately, for one reason or the other, the fertilized egg, the pregnancy, doesn't come into the womb, stays in the fallopian. And the fallopian tube is just tiny tube. If you have a big pen, maybe you can compare it. It's not as big as the big pen, the tube. Whoa. With a small space inside.
Whoa.
And this is where the pregnancy is going to grow because it couldn't get into the womb, where it has been prepared for it. It stays there, so after 6 weeks, it's like an egg size. Just look at the tube I'm talking about, and like, an egg
like the pen
trying to push its way inside. It gets to 8 weeks faster. It's like an orange size. There's no way it can stay. It can't stay. It will get burst. It will rupture. In other words, it will tear around and bleeding will start to fall. You bleed and you can collapse wherever you are. Whether you are in the bus, in the lecture hall, at church, or on the street, or in the market, you can collapse. Because the blood is pouring into the abdominal cavity.
Whoa.
Not in the womb. No, because the tube is outside the womb. So this is what we call internal bleeding.
Internal bleeding.
It's like somebody who has had a road traffic accident and is bleeding inside. You go into shock. Your blood pressure will start to fall. And you get very cold. And you can't even talk. You can't walk. If the people around don't know what exactly is happening, they'll try to put you up. Again, please stand up. Stand up. You pour water in your face, wash your face. They leave you, fall again. Because your blood pressure cannot sustain you to stand. So you are in shock. If you don't rush you quickly to the hospital, you can die. So women go through all these problems. And so the moment the woman gets pregnant, even though it's a happy moment, they start thinking also of the unknown.
Yeah.
Well, a lot of women have died during pregnancy, childbirth, and after.
Exactly.
So what is going to happen to me? Am I going to go through safely? Is something going bad going to happen to me? They think about all this. So it impacts a lot on their psychological well-being. And that is the time when, Pastor, most of these so-called prophets and pastors will catch. They meet you and they tell, hey, what I see around you is a very bad thing. You are going to die. Unless you come to me and I perform certain things for you. So the woman will be in constant fear.
Doc, let me ask this.
And I want to cite one example.
Okay, Doc, finish with the example, then I'll ask my question.
Pardon?
Finish with your example, then I'll ask my question.
Sure, Pastor. Let me give my example.
Yeah.
This woman was almost near term, about to deliver. And her complaint was that she didn't feel the fetal movements. In other words, the baby wasn't moving. So we asked the midwife to check. The fetal heart was there, pumping, boom, boom, nicely. Mommy, your baby is fine. Fetal heart is there. I said, no, my baby is not fine. I can't feel any fetal movement. Another midwife checked. He said, it is there. No, I don't feel it. So they called us as doctors to come and check. We checked, it was there. Pastor, this woman still insisted that no, she was not feeling fetal movements. So in order not to put her into big problem, and also for ourselves, we kept her on the ward.
Okay.
Because she was near labor anyway.
Okay.
The following day we went, she had gone into labor. She delivered a big bouncing baby boy, crying nicely. So it was like, Mommy, so well, yeah, your baby is alive. And what the woman says is, Doctor, means doctor, then I will die. Mommy, why? You are fine. There's no bleeding. Why do you say you will die? Now she's coming to confide in us that a prophet or a pastor told her that the pregnancy inside, the baby was going to die. And if the baby didn't die, then she, the mother, would die. So now we could understand her. So she was in perpetual fear because she knew she was going to die. Why? Because the baby didn't die. So now it was her turn to die. So you can imagine the kind of trauma that this woman was going through. So a lot of these things happen during pregnancy. And even among our local people, when you have an issue with them, you say, can you
yes.
So a whole lot of issues. That is why when they deliver, they are very happy.
Exactly. Doc, all right.
Because
so
when somebody wants to have an issue with you, that's
the way. Okay, it's true. It's true to threaten you.
Yeah.
Doc, so
okay, so you can come in.
All right, we'll be going for break, but before then, at what time does miscarriage set in? At what time do we see women with swollen legs, hurt legs? Are they infection? At what time do we see them, and what causes those things too, as part of the physical symptoms that impact pregnancy? Tackle the infection, the swelling of legs, and the pains first, then miscarriage. Then we move on to
okay. Thank you very much, Pastor. Majority of the women in pregnancy have swollen feet.
Mm-hmm. Is it normal?
It's normal.
It's normal.
About 80% is normal.
Okay.
The reason being that the gravid uterus, which is very heavy now, is lying on the gutter. Let me say the gutter or the pipeline.
The pipeline, okay.
You know, when blood is pumped from the heart, it goes to every part of the body, and a lot of them go to the feet. After doing its work, it has to come back to the heart. Unfortunately, there is this big, heavy stone, let me put it that way, the womb, lying on it. So the blood is not able to flow back to the heart. So you have the feet swollen. So it's a kind of mechanical effect. These people, when they lie in bed or when they sleep and wake up in the morning, there's no swelling. Because when you lie in bed, you can turn to the side. So the mass or the obstacle is off the pipeline. So the blood can flow back to the heart. I hope you are following what I'm trying to explain.
Doc, I'm learning, Papa. I'm learning, Papa.
So the blood is able to flow. So now the edema is off. The swelling, which we call edema, is off. But as the day wears on, you start walking, you sit down like I'm sitting now, your feet, you're not moving them. The blood goes there, is pulled, not able to come up again.
Okay.
So you get swollen. That one is normal.
It's normal.
When you wake up in the morning after bed, and there's no swelling, and later there's swelling, that one is normal.
It's not normal. Doc, come again with that. Is it when they wake up in the morning and there's no swelling, and later on there's swelling, is it normal?
That is normal.
Okay.
Normal.
Okay.
Yes. Because it was only due to the pressure.
Okay.
On the vessel.
Okay.
Causing the edema. So that one is normal.
Okay.
It's physiological.
Okay.
But we have the pathological one, the abnormal one.
Yeah, tell us, Doc.
This is where whether he's asleep or he wakes up or not, the feet is swollen. And it even climbs up to the face and the hands. So you have the feet swollen up to the knees, the thigh, abdomen, hands, and face. That one is dangerous. Okay. And that is the one that is associated with the high blood pressure. And you are entering into what we call the eclampsia. That one is very dangerous.
Pre-eclampsia. Okay.
That one is dangerous.
Okay.
So when you come and we ask you, when you wake up in the morning, is there swelling there? No, there's no swelling. We are not worried. Your blood pressure is normal. We are not worried. It's normal in pregnancy because of the weight lying on the vessel for the feet to get swollen. But funny enough, Pastor, some people, when they come and their feet is swollen, then they tell you, "Oh, they say, "Baby, Charlie, I'm going to get." It's never true, Pastor. It's never true. You know, male or female is just these two. So it could be. So that once you get man can't over, but that's not the reason. So it's just the pressure.
Male child doesn't have anything to do with the swollen leg. Then
at all.
Okay.
So the pathological one is where we are very, very particular. So you check your urine and there's protein. Your blood pressure is up and there's that one we don't even allow you to go. No.
Okay.
What can you? Sometimes we even have to deliver you prematurely.
Okay.
So the swelling is not due to any infection.
Okay.
No. Okay. Not infection.
So Doc, then
if you have any swelling of the feet, it's either the heart which is not functioning well or the liver which is improper.
Okay.
In pathological case.
This one, Doc, this one you're not going to talk. Just mention what are some of the infections the common infections that our wives get when they are pregnant. What are some of the common infections?
The common infection that they get The first one that I'll talk about is urinary tract infection.
Okay.
Urinary tract infection.
UTIs.
UTI. UTI, urinary tract infection.
Yeah.
In other words, the bladder and the urethra, the pipe through which you urinate, infection goes there because around the vagina and vulva, they are very close. If you look at the vagina and where the urethra, where you urinate to, they are very close. So infections can climb up there. But the main reason why they get infection is because the vessel or the tube through which the kidney brings urine into the bladder is open, it's dilated. It's not moving around well because of the hormone that you're producing, the progesterone. So the bladder is lax. The ureter through which the urine comes into the bladder is also lax. So urine is able to stay for too long. And when you have urine stasis, the chance of infection is high. So UTI is there.
Okay.
Urinary tract infection.
Okay.
Some of them also get what we call candidiasis.
Candidiasis is okay.
Candida.
Okay.
Vaginal discharge with itching.
Okay. Okay.
It's also all because in pregnancy, your immune system is weakened. We should never forget about. Once you get pregnant, there's a foreign material in you. Foreign material. So your immune system is weakened.
Okay.
So that it can sustain the pregnancy. Otherwise, if it is the normal immune system, it will reject the pregnancy.
Okay.
It will reject it. Yes.
Okay.
So in this case, your immunity has to go down.
Okay.
So that you can contain the pregnancy until you deliver.
Okay.
Again, they are very prone to getting malaria.
Malaria, okay.
Malaria, yes, because immunity is down. Just like a foreigner who has just come in. Unlike those of us who have been here for a long time, your immunity is built up.
Exactly.
With them, they have this problem. So pregnancy, immune system is down. Yeah. So these are some of the infections that they tend to get during pregnancy.
Elder, before the break, before I go on break, when do we experience miscarriage, or what causes miscarriage? Very brief.
Thank you very much, Pastor. In fact, miscarriage, the actual term is abortion. But you know, abortion has a connotation with it. There's a stigma. The moment you say abortion, hey, what about abortion? Meanwhile, that's not the meaning. Abortion means you are bleeding before period of viability.
Okay.
Before the baby is able to survive when it comes out. Any bleeding is called abortion.
Okay.
We have the spontaneous one, where the woman actually wants the pregnancy, dying it, but then something happens. I'm going to go into that.
Okay.
And the pregnancy is not able to stay. Therefore, you have what we call abortion or miscarriage. We are using miscarriage now because, Pastor, the stigma attached to abortion, we want to avoid it. So we say miscarriage. So anything before 28 weeks in Ghana, 28 weeks
it's abortion.
period of viability in Ghana, is called abortion or miscarriage.
Miscarriage.
Outside, in the developed countries, even 24 weeks, the baby can survive.
Yeah.
So in that case, their miscarriage will be below 24 weeks, but here it is up to 28 weeks.
Up to 28 weeks. Okay.
So if a woman is like 6 months pregnant, 26 weeks, and she has the miscarriage, that is what we call an abortion.
Abortion.
After 28 weeks, it is no more called abortion or miscarriage, but we call preterm delivery. Preterm.
Okay.
Preterm.
Okay.
Preterm delivery.
And that baby can be kept in the incubator.
Yes, please.
Okay. Okay.
So the causes of some of the causes, I can't state all here.
No, just Doc, just 2 or 3 per. Then I'll go home and break and come back. Then we'll continue.
Sure,
give me, yeah.
Thank you very much, Pastor. If you have twins, multiple pregnancy, the womb is so heavy. So the chances that the cervix will open before term is very high. So that is one reason why most of them get miscarriage.
Okay.
Some of them have uterine fibroids. She's able to get pregnant all right, but because of the location of the fibroid inside the womb, it competes with the pregnancy. Therefore, you get a miscarriage. For others, we have what we call cervical insufficiency, or what we used to call in the past cervical incompetence. But you know, Pastor, in Ghana, is incompetence. And you know what the implications. So we call it cervical insufficiency. What does it mean? Once you get pregnant, the cervix is closed, completely closed obliterated until labor starts. So when labor starts, it starts to open to allow the pregnancy or the delivery to go on. But we have some cases where, because of previous terminations, they go and do what we call D&C, dilatation and curettage. They go for a quack doctor or a specialized doctor to put instruments, they open the cervix by force. The cervix normally should be opened by God himself.
When the time is due.
So it's a physiological process in labor. It starts to open gradually under hormones. It opens. But this is the case where you are 3 months pregnant. You want it out. The thing is not open. You have to forcibly go and open it. In other words, you tear most of the fibers that hold it for you. You destroy them. So after 1 or 2 terminations, the fibers are very weak, inelastic again. They are no more elastic. I'm sure when we wear our panties, our boxer shorts, and the ladies especially, when they come to us for examination, they have nice panties on. The elastic band there, very, very strong. You hold it tight, it falls on their skin, very strong. After a whole washing and wear, 3 months, 4 months, it becomes weak. So this time when you wear it, unless you start holding it, bringing it up, it starts to fall down.
That's how the place
the fibers are weak. The fibers are weak now. This is exactly what happens in repeated abortions or D&C, where you force yourself and open it. The fibers are now weak. So when the pregnancy lands inside and the weight starts to increase, it's not able to hold it. You know, it's like a bottle. You open the bottle and the tip, you turn it upside down. That opening is now very, very weak. So with the weight on top, it forces its weight on it, and then it starts to open. And when it opens, the membrane covering the fetus, collecting the fluid in which the baby lies, comes in between. And as you walk, there's friction. So it tears, and the fluid starts pouring out. That's what we call cervical incompetence or cervical insufficiency.
Doc,
no
thank
matter
you so
what you do.
Doc, thank you so much. In case you just joined, I'm discussing this issue with someone who has practiced gynae for more than 35 years, and currently at Sunyani with the SDA teaching SDA hospital there in Sunyani, and he's in the person of Dr. Fojo. That when you mention Fojo, when you go to Sunyani and you mention Dr. Fojo, even a child that is crawling will hold your hand and lead you to where his house is, because he has gained a lot of roots and respect when it comes to this field as a gynecologist. Viewers, I'll go for a break. When I return, we're going to ask more questions. So if you have questions that you want me to talk about, and by popular request, if you really want us to discuss something in pregnancy, and you let me know, I'll assemble him again, and we'll deal with that element, because what we are doing, we are summarizing a lot of issues. Every factor that he raised, every point that he raised, it's a whole topic on its own. But I just want you to know that pregnancy is not a joke. It's not a joke. And when things happen during pregnancy, it's not there are factors that causes those things to happen. But we are here to help you overcome that trauma that surrounds pregnancy. Please don't go anywhere. I'll be right back.
In a world filled with scarcity of peace and rest, but rich in chaos and pains, we cannot but ask the question, when will it all be over? Well, there is good news. Be cheerful, for we are almost home. Our home that brings an end to pain, tears and sorrow. A place where serenity reigns and joy abound. Hope Channel, in collaboration with the West Central Africa Division and Eastern Nigeria Union Conference of Seventh-day Adventists, brings you a 2-week revival program taking place at the Seventh-day Adventist Church, Mile 3, Port Harcourt, from 20th of October to 4th of November 2023. Come and have a sharing with Pastor Holland as he points us all on our way to the eternal home.
The Bible is clear in Revelation chapter 13 that there is a revival coming to this earth that will sweep across the world that will deceive many, and Matthew 24 says will deceive, if possible, the very elect of God.
The program will be aired live on Hope Channel across all of Africa and the world. It will also be streamed live on YouTube and Facebook at Pentecost 2023. Come and get your breakthrough from despair and worries. Come and join our proclamation of hope to a broken world. Come and get the true assurance that we are almost home.
Praise the Lord, we're almost home.
Hi, welcome back from the break. The discussion on table, we are dealing with complications during pregnancy and how best we'll be able to overcome. We just left over where we were talking about some of the infections and the physical symptoms that impact pregnancy. We were discussing about some infections and we went for the break. We are in back. And Doc, but we can let us finish with some of the causes. Now then, probably we'll do a part 2 of the psychological effect and how best we will be able to help our women who are in pregnancy. Doc, when do they experience depression and anxiety during pregnancy?
Yeah, thank you very much, Pastor. When they are not able to eat well, I mentioned hyperemesis gravidarum. Mm-hmm. Where they vomit like hell. They can't drink, they can't eat, they can't sleep. And at certain time, they think they are going to die. Mm-hmm. And it's very rare because they are so dehydrated, there's no food in them, no water, they can't drink. You need water all the time, but they are not able to drink. Mm-hmm. So they feel very, 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 very worried. Mm-hmm. Am I going to survive it? Mm-hmm. Am I going to go through this pregnancy? Am I going to die? Mm-hmm. And especially so when somebody has prophesied, in quotes, that, hey, this pregnancy, something will happen. Yeah, very, very anxious. When they see, when they see any bleeding, mm-hmm. Is the pregnancy going to last? Mm-hmm. Or am I going to have a premature delivery? Mm-hmm. Am I going to go through cesarean section? They feel very worried. Mm-hmm. When they have this loss of, like what that I was just talking about, cervical insufficiency or cervical incompetence, they know that whatever has happened, the pregnancy will not survive. So they are very, very worried. When they come with severe low abdominal pain and the doctor examines and says, hey, we have ectopic pregnancy, they know we are going to go to theater. And they are very worried. And I want to cite one example where
Ella, go on.
Somebody that's personally known to me got wedded, nicely married. Mm-hmm. After 3-4 months, she got pregnant. She was so happy, very excited. Then one morning, she has severe low abdominal pain. So they rushed her to the hospital. When we examined and checked, she had what we call a ruptured ectopic pregnancy. In other words, the pregnancy didn't land in the womb.
Whoa.
And she had ruptured and was pouring, was bleeding into her abdomen. And if we wait, she was going to die. So we said, please, ectopic. He said, no, one sister of hers had ectopic and she never had a child again. So she would never allow us to do the operation.
Oh.
Pastor, you can imagine.
Yes, Doc.
It took us a long time for us to convince her. Because her argument was, me, I didn't do the bad girl thing.
Oh.
I waited. I got wedded. I'm pregnant. God, why are you doing this to me? God, why? I won't allow the surgery. She was very worried. After I talked to her for a long time, she allowed us to do it at that. Fortunately for her, the other two was very, very normal.
Okay.
You know, they had 2 fallopian tubes.
Okay,
the other one was fine. So I assured her that, this tube is gone. We had to cut it. It was ruptured. But luckily, the other tube is fine. So don't worry. Say, you are just worried. You are just trying to make me happy, but I know it will never happen.
Oh.
Because the other girl who had it never had a child. We reassured her. She went home after discharge, came for follow-ups, and she was okay. Pastor, I think around 6 months' time, she came back. She had missed her menses.
What?
So she was happy again. But she had some slight low abdominal pain. I said, hey, another topic. Was head like hell.
Anxiety. Oh.
But we took the scan, And lo and behold, this time it was inside the womb.
Hallelujah.
So we reassured her and she was very happy. So all this while she was very, very worried. This is another topic. But Pastor, interestingly enough, when we took the scan, there were 3 sacs. In other words, 3 fetuses.
That is triplet you are talking about.
Pardon?
Is it triplet you are about to say?
Exactly, Pastor. Triplets. But you know, when you take the scan that early, it's possible some of them will not
survive.
So we said, okay, we have seen 3, but let's wait. 2 months later, she came, all the 3 fetuses were there, triplets. 6 months, they were still there. And lo and behold, she delivered and she had triplets, all girls. She was very excited. So I told her, you were challenging God, blaming God. You see what God has done.
Doc, it wasn't her fault. It wasn't her fault.
Yes.
She has seen it before. She has seen it before. It has gotten closer to her before. She's experiencing it before. So definitely, out of anxiety, definitely she would relate whatever she has seen to whatever she's going through. So we'll start with her.
Exactly. So I told her, this is what God can do.
Yeah.
God gave you one, took it back. You are worried, but now He says, I'm giving you 2 extra.
2 extra.
To the first one that I took away from you. And Pastor, after this, I will send you the pictures.
Oh, all right, Doc. I'm very glad to see her.
I'll send you the 3 girls, very beautiful girls.
Oh,
yeah.
God bless
after
you.
After one topic, some of them can get, but some of them don't because the other tube is bad. So they are worried. So, Pastor, a lot of anxiety, stress, and depression can even set.
Exactly.
So they know that pregnancy, and let me add this before I continue. Pastor, it lasts for 40 weeks. Pregnancy lasts for 40 weeks.
40 weeks.
But most people say, I don't understand. We are told pregnancy is 9 months. So why 40 weeks? It's true, pregnancy is 9 months. But 40 weeks. So we calculate everything, not in months, but in weeks.
In weeks, okay.
And I want people to understand this.
Okay.
In fact, a lot of people, lay people, and even some midwives are not aware of this. Because if you say 9 months, then it should be equal to 36 weeks.
Exactly.
But Pastor, at 36 weeks, it's still not term.
Oh, okay.
You are not term.
Okay.
At 36, you are still not at term. And this is the reason. For Adventists, I think we understand it better. Because every 3 months, we call it 13th Sabbath. Every 3 months, we call it 13th Sabbath.
Exactly.
So, in fact, when you calculate, that is the correct thing. So, if we use, for instance, this month that we are in August now. So, August is 31 days. You have your 4 weeks, which is 28 days. You have 3 days extra. September will be 30 weeks. You have your 4 weeks. You have 2 days extra. October will be 31 days again. You have your 4 weeks and 3 days extra. So 3 days plus 2 days plus 3 days gives you 8 days, which is another 1 week, plus even another day. So in obstetrics, every 3 months, which you call trimester, as I said, is 13 weeks. So if you do your simple calculation, 13, 3 times is 39 weeks.
39 weeks. So 40 weeks.
That's how come. That is how come pregnancy lasts for 40 weeks.
40 weeks is true. It's true.
But a lot of people are not aware. They think, 9 months, 36. So when they come, they say, 40 weeks. They say, no, it's not 10 months. It's 9 months. Yeah. And Pastor, you have to go through all this hell. You can't sleep. You carry this baby everywhere you go. You have blood pressure issues, bleeding issues. So they have a hell of time. They never know what's going to happen. That is why here we say, I've been to
between death and life.
Yes.
Yeah.
And most of the time when they are in labor and they say, me wo, Pastor, sometimes it's true.
It's true.
Because the kind of pain they are going through, it's not easy. Yeah. But when the baby comes out and the realization takes place, then they say, Now they are very happy because they didn't die.
Yeah.
And you know, Pastor, the number of people who died through childbirth before, during, or after is very high in most countries, especially developing countries.
Yeah.
Very, very high. Something very sad that we are trying to always contain to bring the figures down. Some people die because of the bleeding. Some people die because of the high blood pressure. Some people die because of ruptured ectopic. A whole lot of things, Pastor. So there are causes and reasons for them to be worried. But as you said, because they didn't know, and they have seen their colleague or even their real sister or close relative die from it, until they are out, they are never too sure. Therefore, they have cause and reason to be worried.
Doc, my time is up. My time is up. So, viewers, my time is up. My time is up. So we'll continue this. We'll continue this episode. We're going to continue this episode next week. I assure you, we have on our table, we have prenatal and postpartum. So we'll have doctor for all this week's for pregnancy, because I think that people are getting pregnant, and these psychological issues surrounding them are not letting them have peace of mind. And we saw we heard what doctor had told us. And part 2, we're going to discuss the psychological implications and how best we, the husbands, the fathers, the cousins, we can help our wives, our mothers, our aunties who are going through pregnancy. Because at the end of the day, when the baby drops, it's a glory to all the family. So we also need to help them. Doctor, your last word will do, so that we can end this session and we'll prepare for part 2. Thank you so much.
Yeah, thank you very much, Pastor. I think we've been going through pregnancy, the definition, how long it lasts, and the problems associated.
Exactly.
Pregnancy, Pastor, as you said, it's not an easy thing.
Yeah.
For these 280 days, sometimes even goes up to 42 weeks, Pastor.
Yeah.
Sometimes. It's not an easy thing. But once you do your antenatal, this is well. And there's any problem, and we detect and we manage it. With God on your side, you know you're going to go through and you get your baby. So always make sure you do your ANC visits. Take all the medications you are given. Any problem that you are not clear about, you are worried about, please report immediately for the necessary steps to be taken. Thank you very much.
Thank you so much. Thank you so much. Thank you so much. Dr. B. Fojo, James B. Fojo. Ada, finish. Sorry, I've cut you. Sorry. Ada, facha me. Ada, we. We many agent, we be say me chill next part into my word. Ada, we. Finish, please, Ada.
Yeah, so what I was saying was that once you do all these things on your part, with God on your side, sure, you are going to get your baby. And so I hope that all those who are looking for the fruit of the womb, after listening to this, God will do them a favor.
Amen.
And grant them
Amen. Amen. And part 2, we're going to have a special prayer for all those who are searching for and those who are in pregnancy, so that we ask God after the part 2. We're going to pray for them. So that after the part 2, we'll pray for them, and especially. So viewers, thank you so much for your time with me. This is issues associated with pregnancy and how best we're going to help them. This is part 1 because time wasn't on our side. My thank goes to you, the viewer, and my those who made it possible for this to be aired. I told you the casual shirt I'm wearing is from ALSA Clothing, located at Musuku Police Station. If you need ALSA clothing, it's 0269 0246900994 0246 900 994. They deal with kaftans, they deal with office wear for male, female. They do Ankara, and they also have a casual wear like what I'm wearing. So you can call them all social media platform. ALSA Clothing, they are there. He would talk to you. And regards to also Alpha Art, who always put me and my guest on flyer. He's into graphic designs. Anything you want, Alpha Art will be there for you. And please, next week we are going to meet with a part 2 of issues associated with pregnancy. So please stay tuned. Share. You Hope TV, GH, social, Facebook, and YouTube. Please, you can share for people to learn, because this you wouldn't get it anywhere but you get it right here on Wounds of the Heart. May God bless you. I've been your regular host, and the name is Pastor Danabedi Bidiaba. I'm out.